evening, everyone. I'm Dr. Shailesh Gupta, laparoscopic robotic and pediatric surgeon from Max Pathology Specialty, Delhi NCR. So today I'm going to start a very important topic, that is inflammatory bowel disease. Inflammatory bowel disease is a very important topic for your theory, as it is little uncommon in India. Rarely will get a patient in practical for Crohn's or ulcerative colitis, but definitely it is a very important topic for your theory examination, and also definitely it will going to come in your super specialty examination MCQs. So it is important that I have taken this topic from the suggestion. So this is quite a long topic. So today in this part one, I'm going to discuss about the ulcerative colitis, and we are discussing in the next lecture part two, I'm going to discuss the treatment of ulcerative colitis. So apart from the treatment, that is pathology, that is etiology, epidemiology, extestinal features, risk of carcinomas, clinical feature, I'm going to discuss this. And be ensured that you just read the PPTs. This will be enough for your exam preparation. I have covered each line in a quite simplified way. So I started. This is what I'm covering today. I'm covering ulcerative colitis, in which I'm going to cover the epidemiology, etiology, pathology, clinical features, diagnosis, extestinal manifestation, and risk of carcinoma. Treatment part I'm going to cover in the next part two. So first, I'm going to discuss about the epidemiology and etiology. So question number one: which demographic has a higher prevalence for ulcerative colitis? Choice number A: African Americans, Asians. Choice number C: white, Jews, and individual of Northern European ancestry. And choice number D: Hispanic. So at what age the ulcerative colitis most commonly diagnosed? Younger than 20 years of age, 30 to 40, younger than 30 years, and older than 40 years. So किस एज ग्रुप के अंदर सबसे पहले हम ulcerative colitis को diagnose करते हैं? Question number 3: which HLA allele is associated with a more benign course of the ulcerative colitis? DR for 1501, DR 1502, DQ2, B27. So guys, हम लोग बहुत जनरल भी पढ़ रहे हैं और बहुत स्पेसिफिक भी पढ़ रहे हैं. So we are covering each thing, right? So I would request the student to please type their answer in the chat box. And question number 4: what influence does smoking have on the development of the ulcerative colitis? It causes the disease. It has no effect. It has protective effect. It aggravates the disease. Question number 5: what is the relation between the oral contraceptive and the use and prevalence of the ulcerative colitis? Oral contraceptive decrease the risk. No relationship. Oral contraceptive increase the risk, and it only increase the risk in the smokers. So it is more common in developed country, rarely found in Asia, Africa, and South America. Right. So this is a disease of a developed country. It is seen that onset and often relapse occur more beyond August and January. Basically, spring and fall, it has a more it happens more, and relapses also happen at this time of year. So incidence is like 4 to 6 per 1 lakh white adult per year, and prevalence is 40 to 100 cases per 1 lakh cases. So it is quite a huge number in case of white, right? So 1 लाख के अंदर 100 केसेस होना छोटा नंबर नहीं है, काफी बड़ा नंबर है. एंड ये इंसिडेंस जो हम बात कर रहे हैं, वी आर टॉकिंग इन टर्म्स ऑफ वाइट पीपल, राइट? So age distribution, it affect all the ages, but happen more commonly in younger than 30 years of age. ये पहली peak होती है, second peak happen at the 6th decade, right? And it affect both the gender equally and more commonly in white, Jews, and individual of Northern European ancestry. So unknown ulcerative colitis का अगर हम etiology की बात करें तो exact cause जो है वो unknown है, but there are certain factor which is found to be related to ulcerative colitis. मतलब कि directly cause नहीं कर रहे हैं, but कहीं ना कहीं का relation है, right? So there are certain environmental factors are there, like it is found in industrialized countries. So increased incidence in the individual migrating from the low risk to the high risk area, suggesting an environmental factor. Basically, it is more seen in developed countries, and the people who are migrating from the less developed country to developed country, their chances also get increased. तो अगर वहां पे जाके increase हो रहा है तो उसका मतलब ये है कि कहीं ना कहीं environmental factor involved है. Dietary factors are also there, like inadequate fiber intake, chemical food additive, refined sugars, and cow milk. And this is most important line: Clostridium difficile and Campylobacter jejuni have been implicated but not confirmed as a causative agent. तो ये सारे ना रिलेशन है, कोई डेफिनेटिव कॉज नहीं है, ये सब एक तरह से कहीं ना कहीं एट्रीब्यूट करते हैं डिसीज को. So smoking, surprisingly, ulcerative colitis is one disease where it is smoking is protective. Nicotine is reported to induce a remission, whereas in Crohn's disease, smoking usually aggravates the disease. Oral contraceptive use also increase the chances of the ulcerative colitis, and appendectomy basically have a lead to decreased chances of developing ulcerative colitis. इसका कोई basic नहीं बताया सजेशन ने, it is mentioned in one line, right? It is also seen that in the patient with ulcerative colitis, it is an inflammatory bowel disease, तो इनको autoimmune response होता है, वो नाम से पता चल जाएगा आपको, ठीक है? And anticolon antibodies भी होती हैं, pathogenesis well established नहीं है, and defective cell-mediated immunity होता है, which includes leukocyte chemotactic impairment and abnormality of antigen-specific helper specific T cells. Guys, ये obviously एक inflammatory disease है, तो यहाँ पे altered immune और inflammatory response होगा body के अंदर. राइट, ये आपको याद करना है. सो क्वेश्चन नंबर 1 का आंसर है इट इज मोर कॉमन इन वाइट ज्यूज एंड इंडिविजुअल ऑफ नॉर्थर्न यूरोपियन एंसेस्ट्री. क्वेश्चन नंबर 2, at what age is ulcerative colitis most commonly diagnosed? It is diagnosed more in less than 30 years of age. ज़्यादा commonly diagnosed होता है. So which HLA is associated with the more benign cause of ulcerative colitis? Answer is DR1501. सो गाइज डॉक्टर HLA-27 का भी रोल है, जो आपको अभी बाद में पता चलेगा कि HLA-27 का रोल यूसी के अंदर क्या है, राइट? वो यू विल रीड एंड यू विल नो कि तो वहां पे रोल क्या है. सो 1501 इज बेसिकली causes the more benign cause and 1502 causes the more virulent cause. एक्चुअली ये क्वेश्चन मैंने पहले आंसर क्वेश्चन दे दिया है, इसका एक्सप्लेनेशन आपको बाद में मिलेगा, तो आपको अभी डोंट वरी, you will find the exact explanation in the next coming slide. So what influence does smoking have on development of ulcerative colitis? The development of answer is it has a protective effect. So smoking ulcerative colitis is one of the condition where smoking has a protective effect, right? So what is the relationship between the oral contraceptive use and the prevalence of the ulcerative colitis? Answer is oral contraceptive increase the risk. So guys, now we have discussed the epidemiology and etiology. I am going to discuss about pathology. So now there are a few pre-tests. The purpose of pre-test is just to check your awareness about your subject. And जैसे आप जब आप text पढ़ोगे तो you will find, you try to find the answer in the text. So आपको थोड़ा interest बना के भी एक MCQs रखेंगे, right? So I would request the student to write their answer in the chat box. गलत है और भी अच्छा बात है, गलत है तो मतलब कि आपको फिर उसका आंसर मिलेगा and you will not going to आप एग्जाम में गलत नहीं करोगे, right? So question number 1, what is a typical microscopic finding in ulcerative colitis? बहुत ही इंपॉर्टेंट क्वेश्चन है ये. ट्रांसम्यूरल इन्फ्लेमेशन, क्रिप्ट एब्सिस, ग्रैनुलोमा एंड फिस्टुलास. तो अल्सरेटिव कोलाइटिस के अंदर इन चारों में से कौन सा फाइंडिंग मिलेगा हमें, राइट? क्वेश्चन नंबर 2, व्हाट कंडीशन इज कैरेक्टराइज्ड बाय द थिकनिंग ऑफ द कोलोनिक सबएपिथेलियल बेसमेंट मेम्ब्रेन एंड टिपिकली इफेक्ट वुमेन ओल्डर देन 50 ईयर ऑफ एज? क्रोन्स डिसीज, अल्सरेटिव कोलाइटिस, कोलाजिनस कोलाइटिस एंड इश्मिक कोलाइटिस. तो बहुत ही स्पेसिफिक पैथोलॉजी पूछा जा रहा है जिसमें सबएपिथेलियल सेल की बेसमेंट मेम्ब्रेन में थिकनिंग हो रहा है and typically affect women older than 50 years of age. So guys, these kind of questions are typically hidden in the suggestion. Suggestion में एक disease का नाम दिया हुआ है एक दो लाइन के अंदर. So purpose of these MCQs also to bring those facts to the front of you. Second thing is that इस question का importance शायद आपकी theory exam में नहीं है, but this lecture, purpose of lecture is to also to help you in theory exam, in MS exit exam, and also to help you in the NEET SS exam. So I will move forward. Question number 3, what percentage of patient with chronic ulcerative colitis develop colonic strictures? 1 to 3, 5 to 12, 15 to 20%, 20 to 30%. Question number 4, in ulcerative colitis, where is the typical inflammation pattern observed during the endoscopy? So कौन सा पैटर्न हमें दिखेगा अल्सरेटिव कोलाइटिस में जब हम कोलोनोस्कोपी सिग्मोइडोस्कोपी करेंगे, राइट? patchy inflammation with skipped areas, continuous inflammation from the rectum proximally, inflammation only in the small intestine, and inflammation in the terminal ileum only.